Walk.
Well, it's great to be here. It's great to be here with so many people who support children with diabetes. I was trying to get parking here, trying to figure out the system of parking with the license plate and everything else here in Stanley Park these days. And there are lots of people in line talking, and there's several families who had children who were recently diagnosed with type 1 diabetes. The children were here, they'd raised money and been part of this. And I think being part of a greater community always helps us deal with chronic diseases very well. For me, I've been very fortunate in my life. I've had type 1 diabetes for now, well, it'll be 20 years in November, and I've always had people around me to support me, who care for me and love me, and that's part of what this event is about. Of course, it's the fundraising for a cure, but it's also about the community of people who are dealing with this, working together and coming out and supporting one another.
And what are some things about this disease that the average person might not be aware of?
I think how much of a daily challenge it is. You know, I think you know, one thinks, you know, in my case, I feel like I've mastered it a little bit, but once a month, once every couple of months, it really comes and kicks you in the butt, and it's a grind. And what I think, you know, and the key difference I think in surviving it is the support you have. And so I've always earned a good salary, for example, ever since I've been diagnosed with diabetes. If I didn't, if I was poor, if I was low income, I'd be more likely to lose a limb, more likely to lose my vision, more likely to die early, more likely not to live the quality of life I had. Because when I go to the grocery store, I never have to choose, right? I can buy the good food I need to balance off the insulin I'm taking. So I think that's the key issue, and it's just as important with type 2 diabetes, which is kind of an epidemic now in our province. And I think the diabetes issue, much more than what sometimes talked about the aging population, is going to be a challenge for our healthcare system in the years to come. So what we're doing here and what we're doing in general to help people deal with diabetes is going to be crucially important to sustaining our healthcare system, but also to the lives of literally hundreds of thousands of people.